Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Before we begin our presentation, let me introduce myself. My name is Ike Putri from Bamadaslawi University. Today, I'd like to present about the effect of age, parity, pregnancy, distance on low birth weight baby in the working area of Puskesmas Pangkah. All right, I will begin by explaining the introduction. Low birth weight baby is one of the most important determinants of perinatal survival, infant morbidity and mortality, and the risk of developmental disorders and disease in the future life. According to WHO, the prevalence of the incidence of low birth weight in the world was 20 million, approximately 15.5% each year. And developing countries are the highest contributor, about 96.5%. Indonesia is a country with the high prevalence of low birth weight. This is evidence that Indonesia is at the ninth in the world in terms of low birth weight incidence, more than 15.5% of infants each year. In Central Java, 2020, the incidence of low birth weight is still relatively high. 46.4% of neonatal mortality caused by low birth weight baby. Next, one of the supporting factors causing the occurrence of low birth weight is the age of the mother to be including at the high risk. A woman's best reproductive age is between 20 until 35 years. Under and over the age, it can increase the risk in pregnancy and childbirth. The number of live births in Tegal Regency 2020 from January until September was 26,916 with 1,252 low birth weight cases. The highest number, as many as 69 cases in Pangkah sub-district. Let's move on to the method. The study was a qualitative correlational with research with retrospective approach. The population was all low birth weight babies who gave birth in January until September 2020 at Puskesmas Pangkah, Tegal Regency, as many as 69 cases taken by total sampling technique. In this study, independent variables were age, parity, and pregnancy distance, while low birth weight baby. The secondary data was taken from patient medical record of mother who gave birth at Puskesmas Pangkah. The quantitative analysis used cross-step from all variables to determine the effect in each independent and dependent variable. And the data were analyzed by SPSS version 16 with multiple logistic regression analysis. I'd like to turn to results and discussion. From this table, we know that indicates that maternal age has an effect on the incidence of low birth weight at Puskesmas Pangkah with p-value of 0.046. Age under 20 years has no significant effect and having 0.2 times the risk of experiencing low birth weight baby. While healthy reproductive age, 20 until 35 years, is significantly influenced with p-value 0.018 with 0.1 time in the risk of low birth weight. Therefore, mother's reproductive age has lower risk of having low birth weight baby. Generally, parity has an effect with p-value 0.036. Yes, it cannot be identified with which one parity having risk at low birth weight. Pregnancy distance is also significantly affected with p-value 0.005, where the distance of under 2 years has no effect with 0.9 times the risk of low birth weight. However, the pregnancy distance of 3 until 9 years has a significant effect with p-value 0.003 with 0.0 times facing low birth weight. To sum up, the ideal pregnancy distance has lower risk having low birth weight baby. Next. Maternal age with high parity under 20 and over 35 years can experience the incidence of low birth weight. Two young women have poor blood flow to the uterus so that it can be interfered in the transport of nutrients from the mother to the fetus. Another factor was pregnancy distance. A good pregnancy distance is more than 2 to 5 years. If it's under 2 years, the mother has high risk for preeclampsia and other complications during pregnancy and even having low birth weight baby. The age of woman is the most important thing in considering planning for pregnancy because the age determines prognosis, delivery, causing morbidity or complication both for the mother and the fetus. Then, a woman's reproductive age is between 20 until 35 years, which is evidence that there is an effect between age and incidence of low birth weight. The blood circulation to the cervix and uterus for adolescents is not fully developed, so that it can interrupt the process of transferring nutrients from the mother to the fetus. The estrogen function are to increase uterine blood flow, have proliferative endometrium, get the development of endometrial gland used to assist in distributing nutrients from the mother to the fetus. Low estrogen levels and imperfect endometrial development cause the decrease of uterine blood flow and also influence the transferring nutrients to the fetus. Another hormone is progesterone, functions to keep pregnancy going. The hormone is produced by the form placenta. If it produces low level, it will cause preterm delivery under 37 weeks, followed by low birth weight. As you can see, parity is the number of children born to a woman. During childbirth, the uterus will face muscle strain. The more often the more women were pregnant and gave birth, the closer the pregnancy distance the childbirth. It decreased by elasticity of uterus, thus it had no contraction fully. The number of baby born to a woman is the important thing in determining maternal and infant prognosis. Childbirth primipara tend to have the high risk of mother and babies, which can decrease the second and the third parity, rise again at the fourth parity, and so on. The results show that there was an effect between parity and the incidence of low birth weight. The incidence happens to mother with parity more than 4 because the existence of scar of tissue by the previous pregnancy and delivery. The scar tissue causes insufficient blood flow to the placenta so that a partial placenta occurs, thinner fulfills, and the broader uterus. Besides, the result of the attachment abnormalities placenta is inhibiting the nutrient from mothers to the fetus. The incidence of low birth weight on mother with the first parity was caused by the lack experience and knowledge of pregnant women in dealing with the pregnancy. In female reproductive cycle, the minimum pregnancy distance to keep the organ and reproductive system going is going is 24 months, while the ideal pregnancy distance between 2 until 9 years. The statistical test states that there was an effect between pregnancy distance and low birth weight. The woman pregnant having too close distance from the previous pregnancy can provide worse prognosis in the health of mother and baby. It was due to the imperfect form or function of reproductive system yet. The nearest pregnancy distance can cause anemia because the mother's condition has not recovered yet, and the fulfillment of nutrient is imbalanced. However, the mother must fulfill the fetus nutrients. Pregnancy distance under 2 years influence on the next pregnancy because of the unprepared mother's womb. Psychologically, the mothers are not ready yet since the baby still needs more attention. Next pregnancy should be available after having pregnancy distance more than 2 years. Ministry of Health has been carried out some ways to reduce MMR and IMR, such as getting closer the midwife care to the community, providing additional authority to Puskesmas to manage basic emergency obstetric and newborn care, or PONED. In collaboration with doctors, midwife plays a role to improve the use of contraception as a preventive action for women in 4-2 category: too young, too old, too frequent, and too many children. I'd like to conclude my presentation. Most of the respondents in this study were mothers of reproductive age 20 until 35 years, as many as 70%. Majority of respondents was primipara and multipara, approximately 74%, and the rest include grand multipara. Most of the respondents had pregnancy distance of 3 until 9 years. The result of multiple logistic regression analysis showed that there was an effect of age, parity, and pregnancy distance on the incidence of low birth weight at Puskesmas Pangkah, Tegal, Regency. That's all I have to say about. Thank you for having me. Nice to meet you. Wassalamualaikum warahmatullahi wabarakatuh.